A convicted fraudster can get approved to send unsupervised and untrained workers into elderly Americans' homes, and a refugee family can collect $90,000 a year simply by having one family member claim to be the other's caregiver.
There's a network of foreigners running criminal fraud rings within our government, within our country, I should say, defrauding our federal government.
Bob and Betty Buckeye don't care whether the money comes out of their front pocket, their back pocket, their left pocket, or their right pocket. If somebody is stealing their money, whether it's state money, local money, or federal money, it's their money.
100%. Republican lawmakers are digging deeper into Medicaid fraud during a hearing yesterday on Capitol Hill. These elaborate schemes have cost Ohio taxpayers upwards of $1 billion. Let's bring in Ohio Auditor of State, Keith Faber. Keith, thanks so much for joining the program.
Happy to be here, Lawrence.
So explain to the audience, who is stealing the money from the people? Because I'm looking at some of the numbers, and over 70% of the Somali community are on welfare, and it looks like from some of the reporting, they're the number one party that is instigating this. How's that happening?
Well, we think anytime you have a big government program, you're going to have people who want to try and take advantage and lie, steal, and cheat with the program. And frankly, it's incumbent upon the people who run the program, the Department of Medicaid and the other local administrators, to put controls in place to stop it. And certainly we're seeing it across certain demographic groups. In Columbus, I identified 2 zip codes that had disproportionately large utilizations of home health care. We think that a lot of that is located in what is traditionally known as the Somali community in Ohio. But we think the fraud is widespread. It's not just in one area. It's any time you have a big government program that doesn't have adequate controls, people try and figure out how to lie, steal, and cheat with the program.
So let me ask you just a quick follow-up. Is it because when these people apply for this, and I understand a lot of this is fraudulent, but are different communities, different demographics getting special treatment or priority for these, and so the proper investigation isn't taking place?
Well, I think a big part of it is our Medicaid program, and like a lot of our social programs, are predicated on a trust society. We come into this environment where if you say you need help, the premise is we're going to get you that help. And then verification usually happens on the back end. Well, what's happened is we haven't been doing that verification part as effectively as we should. And so a lot of these communities from other societies aren't based on a trust society premise. And so what happens is that they figure out how to manipulate the system coming in, and they just have a lot of people who say, look, let's go out and figure out how to get everybody on the system and take advantage. But look, we need to be better on those controls. Since I've been auditor, we've now identified $9 billion, not just $1 billion, $9 billion of waste, fraud, and abuse in government programs, largely the pandemic unemployment system, and now we're seeing it in Medicaid.
Yeah, so we looked at some of the numbers, and since 2020, over $455 million in Medicaid benefits were paid to ineligible recipients. In 2022, $118 million of duplicate or improper payments, and then up to $24.5 billion in the agency-level failures act on the multi-state enrollment eligibility alerts.
Right.
So just for the people that would be typically ineligible, how does that particular process happen? They don't check or screen these people before they get the benefits?
That's exactly right. What happens is somebody claims to say, I'm Medicaid eligible, I've got an illness, I've got a health care condition, and then what happens is they get put on the rolls. And then the after-the-fact verification, if it's done at all, what we're finding is we just found an audit in 2025 that 15.6% of the people on Ohio Medicaid are arguably ineligible. We found people who were dead. If you're dead, you're probably not getting Medicaid benefits. We found people in jail or prison. They shouldn't be getting Medicaid benefits. And certainly we found a lot of people that were enrolled in multiple states. Now, in the enrollments in multiple states, the beneficiary, the person who is the claimant, isn't getting that benefit. It's the Medicaid managed care organizations. And we found that just in the last time we checked, they were getting more than $1 billion for people who are registered in multiple states, because what happens is the states pay them a per member per month fee for having these people on the rolls. And if you're getting a fee from Indiana and Kentucky and West Virginia, you shouldn't also be getting one from Ohio.
Yeah, they got to stop this, and they got to get control of this very fast. Thank you so much, Keith, for being out front on this issue.
Thank you for having us.
Be sure to like and subscribe for all the Fox News latest on YouTube and catch full shows streaming now on Fox One.